This transfusion reaction in general isn't quite as high yield as the other ones that we talked about because it's actually pretty simple. There's not a lot they can really ask you, but let's make sure we go through it just in case you get, something on it. The concept here is pretty straightforward. So we're saying that this is a non-hemolytic reaction. It's right there in the name. And I don't want to jump too far ahead, but you can see right here, non-hemolytic, right? We're going to have normal labs. We're not going to have hemolysis labs that indicate that we have red blood cells being broken down. It's in the name, right? Febrile, non-hemolytic reaction. How does the patient present? Well, they're probably going to present with a fever, all right? And in general, the symptoms tend to be much milder in this reaction. So let's backtrack a little bit. What is even causing this to happen? The concept here is have some sample of blood that, is just kind of sitting there on the shelf, and let's just say it's a sample of red blood cells, right? So this is going to be 1 unit or 2 units, whatever it is, of red blood cells, all right? And these red blood cells in that sample are going to have some white blood cells. Probably not a lot, but there might be some that are mixed in with that sample. Okay, so we have some white blood cells here, but again, not usually going to be very many. Now, these white blood cells, over time, as they're sitting here over a long period of time, they might start to leak out some of their cytokines. Okay, so over a long period of time, some of those cytokines might leak out into the sample, okay, which is exactly what you see here, right? So these cytokines are kind of leaking out over a long period of time. And then when I go to give this to a patient, right? So if this is all kind of going on inside of my sample, and now I go to give this sample to my recipient, right? And now I have all of these cytokines floating around in the sample. And that's going to cause kind of an immediate reaction in this patient. All those cytokines, things like we talked about, like interleukin 1, interleukin 6, TNF, right? What are these going to do? They're going to increase the temperature set point. These are the things that make us have a fever when we have an infection, right? They're acute inflammatory mediators. That explains why these patients will have a fever, potentially, after they get this transfusion, right? It's because these cytokines are leaking out. Now, that's the classic high-yield thing to remember when we're talking about this mechanism. There is another portion of this where in some situations, the recipient, right, actually has antibodies against antigens on the donor white blood cells. The actual pathophysiology of this is beyond the scope of step 1. In fact, this doesn't get asked about as frequently, but it's important to know that this can also happen. If I did have antibodies against my donor's white blood cells, then I might mark these for destruction, and when I destroy them, I might get a cytokine leak. Okay, so it's a similar concept, but the thing that would be different if they asked a question about this, which I don't think they would, in these situations, you may actually get a positive Coombs test if you're looking for that specific antibody that bound to the white blood cell. Okay, again, pretty much beyond the scope of step 1. So what you see on this slide, I think more or less will get you the right answer. Okay, but there is some variability here. That's just why I bring that up. But in general, you would expect there to be a negative Coombs test, especially if you're doing a Coombs test using anti-A, anti-B, anti-RH, right, anti-KID antibodies in the sample, right? If you're testing for those, you're looking for red blood cell breakdown, that's going to be negative, okay, in these patients. And again, majority of these cases, especially when they're asked about in board questions, are going to be like we talked about, due to this white blood cell cytokine leak. The timeline is usually going to be hours after the transfusion, which doesn't really distinguish this from some of the other diseases. But what we can get from this is that, in general, we don't have red blood cell breakdown, which helps you kind of zero in on what we're talking about. Now, what would you normally do if this patient had symptoms, if they got a fever potentially during the transfusion? We already said the answer is always going to be immediate cessation of the transfusion. But on future occurrences, you would give them blood products that have less white blood cells. Leuko reduced, right? Leuko meaning white blood cells, reduced white blood cells in the blood products because you're afraid of the cytokine leak potential. So you might be saying, okay, well, what can I look for to really kind of narrow me in on this, besides some of these little things that we mentioned? Well, the key vignette is usually going to be about a pediatric patient. That's classically how these are asked about. So look for, younger age patient in general that ends up having a fever, but has relatively normal labs. That will be very classic for this presentation. So just kind of keep that in mind. A little bit different from what we talked about previously.